recording, and I'll share this screen. Okay. Hope it's visible to you all.
Yes, sir.
Fine. Then let me proceed. Okay. Please try to internalize the content while I'm going through healthcare waste management, and try to visualize the scenario. So in the current context of COVID-19, even waste generated from your home, your town, even a healthcare institution. So try to correlate these things, and it will be very, very important to understand. Okay. So healthcare waste management. So within 1 hour, we try our best to cover some basic principles of healthcare waste. So definitely, you need to understand the healthcare waste management and apply its concept. Within 1 hour, we have, as usual, type of evaluation as well as class for 40 minutes and 15 minutes evaluation and 5 minutes feedback. So you need to reflect today's class through writing and MCQ test. And this is one of the important questions for the upcoming exam too. Fine. So these are the content. First, you should understand why. You should understand healthcare waste management. What is the scenario? What is the rationale? What is the justification? What is the need of healthcare waste management learning? Why, as a medical student, we should learn healthcare waste management? This is first question. The second question, basic introduction related to waste management. Then definitely composition, classification. What are the sources? What are the risk group? What are the health hazards of healthcare waste? How to manage? What are the challenges? And definitely we need to conclude, or we need to summarize a take-home message. Okay. So after entire class, what you learn? What is a reflection for yourself, or community, for your care, okay, patient care. And definitely we need to acknowledge, we need to provide some references for the content. Okay? We try to give acknowledgement for concerned experts. So let me start from background information. So it's in Nepali and English. So you can see Norvik Hospital, one of the famous hospitals in Nepal. Norvik World's Conference on Waste Management. So it was published in one of the National Daily of Nepal. Okay. There is another snapshot, चिकित्सा जन्य पूर्व व्यवस्थापन नगर्नेलाई कारबाही. So punishment for those who are not following proper management of healthcare waste. Okay. So these are two news cutting, okay, from national news. So this is background, so why we need to know healthcare waste management. You can see these are the two symbols, okay, used in healthcare waste management. SCWM means healthcare waste management. And these are two symbols frequently used in the context of healthcare waste management. You can see danger, infectious waste. This is logo. Okay? And another one is cytotoxic waste. So this is a symbol for cytotoxic waste. Cytotoxic hazard symbol, and this is symbol for infectious waste. These are the two symbols frequently used. Okay. Surya B Hospital of Nepal is pioneering hospital waste management. And minor changes in the hospital structure or process can reduce hospital waste, said experts. So experts said, okay, in one of the conference in the Green Hospital Conference in the capital Kathmandu, in Nepal's capital Kathmandu. So if we have some minor changes, we can reduce hospital waste. These are all background of this topic or of this lesson. Okay. You can see all India training program on biomedical waste in Patna University. Okay, you can see there are experts presenting their thoughts or discussions regarding biomedical waste management in India. And Nepal, health waste management in Nepal, you can see snapshots of different programs, different projects related to healthcare waste management. This is one in the Aran BPKH, SPB Korea Institute of Health Science. These are all backgrounds. So you can see in this Nepal Mountain News, government alarms for hospital for strict waste management. Okay. You can see the waste generated from hospital. Gorkha Patro, and you can see healthcare waste management as an editorial conference on countries' role in greening the healthcare, okay, greening healthcare policy. These all are background. Okay, no need to know all its content. Just I'll try my best to energize you. Your share. Landfill site to core base basic 10 lakh amdani. So we can generate 10 lakh. Okay. From we can get almost 10 lakh rupees, means 1 million from waste at landfill. Okay. These are some of the research. Okay, some of the projects of program in our nearby municipality, Anguta municipality of Nepal. Fine. And you can see one data related to waste amount of waste generation. It is estimated that Nepal generates some 2018 tons of healthcare waste annually. And if infectious disease increases, then the healthcare waste increases. It's directly proportional, because we can't reuse the personal protective equipments and other instruments, especially used in infectious disease, which are highly infectious, highly contagious. So in the current context, maybe we have more healthcare waste. Okay, it's around 3,000 tons of healthcare waste. I think I didn't need to give you this detail. Okay, let me share one data. Okay. For the instance, 2020 years ago, World Health Organization estimated that injections with contaminated syringe, actually which is produced by our hospitals, caused from us, from our hospital, from healthcare practitioners, 21 million hepatitis B virus infection. 21 million hepatitis B virus infections, which is due to contaminated syringe or injection. And this is our fault. 2 million hepatitis C virus infection, this is our fault. And 260,000 HIV infections. See the context, okay, here. Due to our hospital waste, okay, with contaminated syringe, it caused 21 million hepatitis B virus, 2 million hepatitis C virus, and 260,000 HIV infection, almost 0.3 million. This is the background. Why, as a medical student, as a future doctor, you should know healthcare waste management. Okay? The Himalayan Times, in their editorial, they wrote, there is a lack of appropriate policies and the plans, though we have few, and their implementation at the local, regional, and national level. There is lack of implementation of those policies and the plans. It is urgent that every health institution had a separate waste management unit, and which is lacking in most of the medical colleges and tertiary hospitals. The government should prioritize special measures for creating a healthy society. We doctors, we healthcare providers, is to think ourselves we are, superstar. Our profession is quite good. We are boss of this society, but this is just a rumor. Let me say it's only rumor. It's illusion, because we are creating, disease because of our healthcare waste, because of lack of knowledge, or because of, avoidance of managing proper healthcare waste. Okay? Managing proper healthcare waste. There's a future doctors. Okay, you should be very much careful regarding healthcare waste management. Maybe you will be a doctor, clinician, or public health practitioners, or hospital owner, okay, as a director. So you should, think about this. Kathmandu, there is famous campaign, Bagmati cleanup campaign. Okay, and what they found, the waste collected in Nepal Medical College Hospital, Jorpati, and Nepal Orthopedic Hospital, operated by the Nepal Handicap Association at Jorpati, 1 are reportedly thrown into Bagmati River through their respective sewer line. So they connected their sewer line directly to Bagmati River. And there is another campaign, Bagmati cleanup campaign. See the situation. The leading hospitals, medical colleges, we used to taught healthcare waste management. We used to, produce medical doctors, nurses, and they are, directly mixing their sewer waste to Bagmati River or Holy River. And there is another group of people who are going for Bagmati cleanup campaign. It's a dilemma. What should we do? Please try to think and rethink regarding this concept. One group of people going for Bagmati cleanup campaign, and there is existing, sewer line to Bagmati River from our hospitals, leading hospitals. We are supposed to stop those type of activities. Parliament, this is all Nepalese context, okay? Parliament approved the bill on the Solid Waste Management Act 2011, that provision of fine of 500 to 1 lakh and jail sentence from 15 to 180 days for violating the waste law. This is for general waste or solid waste. Okay. See, if you find, okay, people, throwing their general waste to prohibited area, so you can complain to police, and they may have to pay for ranging from 500 to 1 lakh rupees, and they have to go for jail sentence for 15 to 180 days. So for violating the waste law, so you can complain. As a medical student, you can complain. Some hospital found ways to utilize money earned from their new recycling venture. Now, especially in our peer hospitals, so they have different process of segregation or management of healthcare waste. Actually, they are earning money. So sometimes, okay, we can earn money from hospital waste, and that money which we earn can be used as salary for those persons who worked for waste management, or or waste segregations, or any support for healthcare waste, and it will make our healthcare waste management or healthcare waste management in our hospital setting. It's more sustainable. It's called self-sustaining. Okay, self-sustaining. Sustainability is the issue, and which can be through new recycling techniques. Okay, and the amount of money generated from those hospital waste can be utilized for maintenance, salary, or everything. Right. Okay. I don't want to go all details about this. So you can see this is one case study, okay, related to healthcare waste. You can see here implementation of safe healthcare waste management system in the Western Regional Hospital, Pokhara. So before and after implementation of safe healthcare waste management system in Western Regional Hospital, Pohara. So before implementation of this system through GGHH, means Global Green and Healthy Hospitals. Okay, sometimes we used to ask this question also. Okay, please try to know its abbreviation. Global Green and Healthy Hospitals. Okay. So before implementation of this program, open waste burning before safe healthcare waste management system implemented. You can see. So before implementation of system, so you can in its background you can see beautiful mountain of Nepal, but here you can see at the site of Western Regional Hospital. So they are burning, okay, healthcare waste, which is hazardous. After implementation of system, you can see it's changed drastically. Okay? So as a medical student, we should try to know from activities or from tracks or real example. Okay. So let me go to next slide. So we need effective healthcare waste management in Nepal. We need injection safety in Nepal. So these are some of the articles published in different journals, okay, related to healthcare waste. If you are interested, you can go through these articles for more knowledge. And this is one of the interesting domain, okay, for post-graduation too. Okay. Healthcare waste management practice in Nepal, published by one researchers from Nepal Health Council. Okay. The study of hospital waste disposal practice in a tertiary care hospital. There is another research. So if you are interested, you can read. Now, after background, these all are background. Okay. Hope it will energize you the importance of why we should know healthcare waste management. What is the importance? Or what are the importance for better healthcare waste management within your institution or even in your home setting or municipal setting or country setting? So what is waste? According to WHO and adopted by Nepal Health Council, the waste generated during the diagnosis, testing, treatment, research, or production of biological products for human or animals too. These are waste. See the scenario. Wilson wrote 1981. Any unwanted residue, we can see this figure. This is our real example. And you can see this boy is carrying a needle in one end and another hand fish. So he may prick by this, he may get pricked by this syringe and may have, may transmit hepatitis B or C or HIV. And from this fish, okay, maybe lead poisoning. Lead is dangerous chemical. So you can see lead poisoning, okay, because of contamination of lead or water pollution, okay, in the surrounding water. If we have, disposal of healthcare waste management, so lead is common in batteries, and which is commonly used in our hospital setting, and it may have lead poisoning. And from the biological cycle, it can ingested by this child or family members, and it may have lead poisoning. So see the problem of healthcare waste. So any unwanted residual material which can't be discharged directly, like one of the famous medical colleges, directly to their and surrounding holy river Bhagmati, or after suitable treatment can be discharged in the atmosphere or to a receiving water source or used for landfill, is called waste. Okay? There are many definitions. Okay, biomedical waste management and handling rule 1998 of India said biomedical waste or healthcare waste means waste which is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities pertaining to or in the production or testing of biologicals and including categories of waste. So what you have to know in the definition of the biomedical waste, two concepts. One is animal health, another is human health. So animal health or clinical, both in animal health and human health, for clinical services or for treatment or research as well as both. Okay, so for treatment means definitely diagnosis, treatment, immunization for animal or humans, or some research activities, okay, like biologicals, development of any vaccines, any new modalities of treatment, so forth. So it consists of waste, okay, it's hospital waste. Now let me tell you composition of healthcare waste. Okay, so let's say healthcare waste 100%, and we have two major categories. One is general healthcare waste, which is around about 75 to 90%, and hazardous waste 10 to 25%. These are general healthcare waste like plastics, bottles, which are non-hazardous, and we have only 10 to 25%, 1 out of 10 or 3 out of 4, 25% means 3 out of 4 or 1 out of 10 hazardous waste. 10 to 25% only hazardous waste in the healthcare waste. But what is the problem? We are mixing those waste and making entire healthcare waste is hazardous. If we segregate in its source, then we need to manage only 10 to 25% waste is hazardous waste. Just by segregation, we can reduce the volume of waste by 75 to 90%. Till now, hope you understood. Okay, let me go in detail. Hospital waste, so we can say in this way also: infective, non-infective. Maybe non-infective, we have solid or maybe liquid waste. Infective, solid, liquid waste. Sometimes we may have gaseous waste also. Okay? So these are different categories, different types of healthcare waste, composition and content. Again, you can see non-hazardous and hazardous. So under the hazardous, we have infectious and other non-hazardous. Like infectious waste means non-sharp object, sharp object, plastic, disposable, liquid waste, which are infectious. Other hazardous may be radioactive waste. I think you recently heard Birat human disaster. Okay? Let's say it's a human disaster which killed almost 100 people and more than 4,000 injured. This is man-made disaster. Okay, in your 7th semester, I think we'll teach you what are the different disasters. Radioactive waste, discarded glass, pressurized containers, chemical waste, cytotoxic waste, and incinerator. Yes, okay, incinerator means we have one machine known as incinerator. Okay, where we used to burn our waste in 1000 degrees centigrade. We have a small boiler in our hospital too, in our lab too. Again, for more clarity, okay, this is all example, all the categories are classifications of healthcare waste from different perspective for more understanding. Okay, infectious, radioactive, chemical, okay, hazardous medical waste. Sometimes we have anatomical part, even in your anatomical department, or even in hospital setting after surgery, we have some anatomical part. So we have non-hazardous waste like plastics or foods. Okay. Now you can see, you can use this do not graph also. You can see at the core of this circle, this is infectious waste, which is highly contagious, then medical waste and hospital waste. So infectious waste or hazardous waste is subdomain of hospital waste. So it's around only 10 to 25% is 90 to 75%. Okay, total. So 10 to 25%, and this is this two 90 to 75%, 75 to 90%. WHO categorized, classified healthcare waste is infectious waste, pathological waste, SAR, pharmaceutical waste. Infectious means infectious waste generated from pathology lab, culture, waste generated from isolation ward, or COVID-19 or material or equipment contaminated with infected patient and etc. Okay. Pathological waste, which are not infectious directly, but it may, lead to infection after some time with contamination of microbes like human tissue or clothes, blood, and other body parts. Okay. Sharp instrument, maybe needle, scalpels, okay, infusion sets, knives, plates. Okay, pharmaceutical waste, expired drugs, or unused bottles of liquid medicines, okay? Genotoxic waste, some genotoxic chemicals generated from cytotoxic waste, after treatment of cancer patient, chemical waste, lab reagents, waste with heavy metal like thermometer, okay, mercury thermometer, mercury sphygmomanometer, PP machine, okay, and batteries, mercuries or lithium, lead toxicity, okay, and some pressurized compression like gas cartridge, aerosol cans, okay, gas cylinders, and definitely radioactive wastes for research purpose, okay, for diagnostic purpose. Radioactive materials are increasing day by day, so which creates another sets of waste. Okay. So what are the sources of healthcare waste? Almost all institutions related to health, government hospital, private hospital, medical college, nursing home, physician office, OPD, clinic, dispensaries, okay, mortuaries, medical research lab, animal house, blood bank, slaughterhouse, lab, research organization, vaccinating center, biotechnology institution, or approximately almost all. Even person's home. Sometimes we have, expired medicine in your home, and we used to throw in the river, or sometimes we used to bury, or we used to burn. But what is the best method? You should understand. So your home may be the source of healthcare waste. Sometimes you used to throw those unused or expired medicine your nearby river, or used to burn with other wastes, or used to bury. But is this right management of healthcare waste? Up to this class, I think you will understand more, and you will apply in your day-to-day life also. Or you can communicate with your family or your friends, or even patient through OPD, or in your clinical setting. So when you live, medical doctors, and you are sitting in your clinic, and sometimes patients used to ask the questions, or doctors, how can I manage my healthcare waste, unused drugs, or expired medicines in my home surroundings? Then you need to tell them what is the best solution. So as a medical student, it's more applicable in your clinical practice too. Okay, so till now, hope you understood a few things. Okay, so we have only 40, I think 37 students. So till now, do you have any confusion or any problem? Am I audible to you all?
No, sir.
Hopefully, if you get more confused, then I'll be more happy, because it's not a single through single class you can't understand all the concept of healthcare waste management. So till now we should know what is healthcare waste. As a medical doctor, why we should let me stop here. So as a medical doctor, so why we should understand healthcare waste? What is the importance of healthcare waste? What is the background? What is the rationale? Why? What is the need of healthcare waste? You should know. So what is healthcare waste? Then you should easily understood what is healthcare waste. What are the different sources? It is from your home, from hospitals, from a healthcare institution, from research center, everywhere. And what are the different categories? Hazardous waste and non-hazardous waste. Even in the hazardous waste, we have infectious and non-infectious waste. So you should understand. And the condition, the current present situation of healthcare waste is patent in our hospital system, everywhere in our research institutions. Okay, even in the renowned hospital, they used to throw healthcare waste in nearby jungle, nearby river, or they used to burn. Most of them used to burn, or most of them used to mix with municipal waste. Almost all hospitals of Biratnagar, they used to mix their hospital waste to municipal waste, and they used to dispose those waste in nearby river, Singha River. And ultimately it comes to their home, because every day we need green vegetables, and people used to wash those green vegetables, green leafy vegetables in that particular river, and it will ultimately come to our own system. Even the director of hospitals, or superintendent of hospital, doctor, nurse, or the businessman are common people too. Even animals. Then through the biological food cycle. So we are creating problems. We need to be very, we need to be very cautious. Now, every day we are facing different, problems. Okay, like COVID-19, one of the infectious disease or other disorders. I may need to take class, no problem. So, I'll not burden you more because it's maybe difficult to complete everything here. Hopefully tomorrow I'll proceed further for the remaining part, and maybe I need another one class because this is important. I hope you understood the basic concept of heroes. So do you have any question, any queries till now? If you have any, okay, then I'll try my best to answer your queries. I'll try my best to, make more clear regarding these concepts. So do you have any question, any comments? Okay, I don't want to bore you more, okay, because it's already, 3. It's almost 3, so maybe difficult you to know all the concepts of healthcare waste management in this context. So are you okay till now?
Yes, sir.
Anyone? So let me proceed for a few more slides. Let me proceed, okay, because I think it's wise to give you more concept. Okay? Now we can see how healthcare waste, generated. Waste generation differ not only from country to country, but also within the country, even within hospitals. In different wards, we have different, amount of healthcare waste generated. And the waste generation depends on the established waste management methods of hospital, the segregation system, the knowledge of healthcare practitioners over there, how much they are knowledgeable, how much they are responsible or accountable for waste generated while treating their patient. Type of healthcare establishment, is it tertiary hospital or district hospital or clinic or specialized hospital like cancer hospital? Differently we have more cytotoxic waste. Proportion of reusable items employed in healthcare, okay? So proportion of reusable items and proportion of patient treated, how much patient we used to treat, how much infectious patient, how much non-infectious patient treated. So it's all, these are the factors responsible for the amount of waste, type of waste generated within our health institution or hospital. Even, we are lacking in our country, especially in developing countries like us, LMICs. Okay, low and middle income countries, it's called LMIC, low and middle income countries, it's called LMIC. We have less data or survey related to healthcare waste. So you can see different composition of waste. In average healthcare waste estimates, so I extract this from your part. You can see normal domestic and urban waste 80%, 15% pathological waste, 1% is half, chemical and pharmacological 3%, and special waste 1%, which covers radioactive waste, cytotoxic waste, pressurized container, broken thermometer, and used batteries. This is the ideal. This is general composition of healthcare waste. This is our generation of the hospital waste in South Asian countries. Okay? It's about, in Nepal, it's about 0.5 per kg per bed per day. Okay, this may be your MCQ. Okay, so it's about 0.5 to 1. Okay, 0.5. It's not 25. 0.5 per kg per bed per day. If we have 100 patients in a ward, then 50 kg per ward per day. 50 kg. In India, it's more 1 to 2. Okay, Pakistan almost 4, but there is wide range from 1.63 to 3.69. This is all about average tentative. Okay, it's not exact because it will change from hospital to hospital setting, from type of healthcare institution, from hospitals having proper waste management protocol or accountable health hospital administration. These are all factors responsible for generation of hospital waste. So, what are the risk group? I think I need to stop here. So, this domain, subdomain, or chapter risk group: medical doctors, definitely nurses, healthcare auxiliaries, or health hospital maintenance personnel, patient in healthcare establishment, visitors. Okay, the study suggested that if we, try to decrease the visitors visit in our healthcare establishment, we can reduce waste. The non-hazardous waste producers are healthcare visitors. Visitors are more, are the sources of non-hazardous waste. You can see in our, hospitals, LMICs, India, Nepal, if one patient, are admitted in certain healthcare institutions, I don't know, we have lots of visitors. And sometimes, somewhere in the war setting, there is, ongoing like party, okay? Hospital visitors used to come and they used to stay there for a long time, more than 5-10 visitors, and they aren't talking about their, village, their history. They are almost enjoying, okay, though it's good for patient, for homely environment, but in a healthcare perspective, it's quite, hazardous because of possible chance of nosocomial infection, okay? For the or patient as well as for surrounding patient as well as for themselves also. There are other persons like persons who used to have used to go for laundries, okay, waste handlers, transportation staffs, waste transportation staffs, or ambulance driver. Workers in waste disposal facilities like landfill, incinerators, including scavengers. Okay, so these are risk group, and where we can get exposed. Generation means production, nurses, doctor, patient, visitors. For you, segregation means separation. Sweepers and cleaners. Collection, again sweepers and cleaners. Storage, sweepers and cleaners. So they are more exposed to in the process. So where, in which process of healthcare waste, healthcare waste generations, sweepers more effective. If you get this question in your MCQ, definitely segregation, collection, or storage. Which one of the following is not? Then generation may be the answer. Okay, generation, segregation, collection, storage. Treatment, person who involved in treatment or incineration and disposal, maybe acid contamination water, water contamination, or landfill improper disposal, or scavengers, okay, or general public or municipality waste workers. We work for general waste, home-based waste, not healthcare waste. So in the entire process from generation to disposal of healthcare waste, you can find those group of people used to be, infected or contaminated or transmitted or at risk of having hazards. Okay, health hazards. What are the different health hazards? Hazards from infectious waste and SAR, hazards from chemical and pharmaceutical waste, hazard from genotoxic waste, hazards from radioactive waste, and public sensitivity. Okay, ugly looking. Okay, and ugly looking is another important factors. So these are some of the hazards. According to this title, I think you can assume what are the hazards of infectious waste and SARs, chemicals and pharmaceutical waste, genotoxic waste. This may be cytotoxic, radioactive, maybe cytotoxic, maybe cancer producing, or public insensitivity. I think I need to stop here up to this slides. Hazard from infectious waste, maybe it leads to puncture, cut in the skin, ingestion, okay, inhalation. Chemical waste like pharmaceutical waste, explosive, the latest Beirut, disaster, okay, explosive, hazard from zero toxic waste. Maybe it will, increase the cancer occurrence for those who handle zero toxic waste. From radioactive waste, maybe dizziness or headache, vomiting, okay, and more serious problems. Public sensitivity, if you find, huge waste collected nearby your hotel or hostel or hospital or municipality, it's difficult to, cross that way. We need to go either another way or we need to use masks. And we all, face this problem, public sensitivity. So regarding management perspective, so now how to manage healthcare waste. So in my next class, we'll learn together healthcare waste management principles, practices, and better solutions for this growing burden of healthcare waste. Okay, let me stop my presentation here and hope you understood basic concept of healthcare waste types and the process of healthcare waste generations and the possible persons who can have problem related to healthcare waste, hazardous waste or cytotoxic waste, and the data related to amount of production in different countries. What are the risk group? What are the process of healthcare waste generations? As a medical student, where we can work to reduce healthcare waste. Okay, so after this class, I hope you understood at least the basic concept, concept, or you can internalize the rationale of just why you should do healthcare waste. What are the best ways you can advocate for yourself, or family, community, or hospital, or government. Okay, we have only 33 now. Okay, let me take a screenshot. Okay, please wait for 1 minute. Let me have a screenshot, and I'll try my best to find those students who failed to complete this class. Okay, because it's too much. Okay, let me first complete your screenshot. We have only 2 screens, so let me print this screen. Then those who are absent in this print screen out of I think 74, 76 students, we have only 32, only 29 actually. Okay, let me, though we have record also, and those who fail to attend the class, definitely I need to deduct their marks in the exam. But exam is not only based on your MCQs, ACQs, or just 3 hour or 1.5 hour evaluation. It's a continuous process. It's a portfolio assessment. How much attentive you do in your class, how much interactive, how much sensible, how much accountable. This all matters in medical education. It's not other schools. It's medical education. So the accountability, responsibility, discipline, and coordination, interaction. This matters, and as community medicine experts, I need to teach those things. I need to realize those things. So please convey to your friends, those who left this class, to send me later why they are absent. Otherwise, I need to take some action, because it's not good for you, not for me, for you. Because while we're interacting, we can learn more. Okay? We can learn more. We can internalize more. So those who are still present, thank you very much for interactive. Try to make more interactive. We are learning together. I'm not teaching you. We are learning together. So please try to bring more content or examples. Maybe we can discuss in our Google Classroom or in our messenger groups. Try to interact more. We are learning together. It's not about so I am mentoring you, but we are learning together. Don't try to develop yourself like traditional lecture class, just for 1 hour, just engaging students. And this is not the good way for medical education. Try to engage yourself, try to interact. Okay, we are learning together. I'm not the expert subject. I am not the expert at all, but I have some knowledge, and I'm trying to deliver that knowledge for you. And from you, you need to interact more so that we can have same goal to understand more and more. And understanding is not is not the solution. Implementation is the solution. Okay? So we need to implement in our day-to-day practice, in your personal as well as professional practice. So thank you very much. I think I need to stop here. If you have any queries, any questions, still we have 30 seconds more, or I'll stop here. Are you satisfied enough? Let me stop. Okay. Do you have any questions, Jitesh or Janvi, Nabaraj? Those who are in my screen on my screen. So do you have any questions?
No, sir.
No, sir.
No, sir. Then please, okay, please go through all the previous classes and the recent public health events or activities for your upcoming exam, and it will be more implementable. You can find more applicable questions, not like theoretical based questions. So you need to be very careful while reading. Try to read, try to interact with your group. If you have any queries, any questions, you can raise and we can discuss together. And hopefully this is your first semester exam, and I hope you will get good understanding of this learning point. And don't worry about the marks. You worry about the process of writing and more achievement, or it will keep on your pace. Okay. So you all have individual learning plan, ILP. It's called ILP, individual learning plan. You all have your ILP, individual learning plan. So please try to compare yourself, not others, so that how much you improve, okay, day by day. So that matters. Comparing with others, with senior, junior, or classmates does not matter. It matters about your own individual learning plans. So what are improvement in your learning? What are improvement in your gaining the things? So this matters ultimately. So this is all about today, and let me stop here. So thank you very much, and let me stop. So have a good day. Take care.
Thank you, sir.